Cholera. Tinubu directs FEC to set up cattle to oversee emergency operations. Abuja. President Bola Tinubu has directed the Federal Executive Council, FEC, to set up a committee to oversee the Cholera Emergency Operations Center operated by the National Center for Disease Control, NCDC. The Minister of Health, Dr. Ali Pate, disclosed this while briefing State House correspondents at the end of the council meeting presided over by the president at the council chamber, Presidential Villa, Abuja. He also disclosed that the cabinet committee would comprise members from the Federal Ministry of Health, Finance, Water Resources, Environment, Youth, Aviation, and Education. He added that the committee's effort was in addition to state government support to ensure Nigeria made progress in reducing open defecation. The minister said, the council then approved a cabinet committee comprising the Federal Ministries of Health, Ministry of Finance, Water Resources, Environment, Youth, Aviation, and Education because some of our children will be returning to school. In addition to this, the state governments will be co-opted so that Nigeria makes progress in reducing open defecation because cholera is a developmental issue that requires a multi-sectoral approach. The president directed that cabinet committee be set up to oversee what the Emergency Operations Center led by NCDC is doing and for the resources to be provided, complemented by state governments. The minister said that at the moment, 31 states had recorded 1528 cases in Nigeria with 53 deaths. At the moment, about 31 states have recorded 1528 cases and 53 deaths in Nigeria. That is what we are working on through the Emergency Operations Center that was activated by NCDC on Monday. Now we have a cholera outbreak, and we discussed it extensively in the council in addition to a new emergence of yellow fever specifically in Bayelsa State. On cholera, we are in the middle of the 7th pandemic globally, which is decades in the making. In 2022, the world had almost 500,000 cases of cholera, so it is not only peculiar to Nigeria. In 2023, almost 700,000 cases of cholera were reported by the World Health Organization. This year, more than 200,000 cases have occurred in 5 regions of the world, he added. He also emphasized that a multi-sectoral approach was required to tackle the outbreak. Nigeria off track to meet sanitation target. Meanwhile, as Nigeria faces a critical sanitation challenge with the cholera outbreak, health experts have called for a multi-pronged approach by prioritizing sanitation and enforcing regulations against open defecation. The experts, who said the persistence of open defecation was jeopardizing the nation's commitment to ending it by 2025, harped on promoting behavior change for the country to get back on track to meet its sanitation targets and ultimately save lives. They acknowledged the need for a shift in strategy, emphasizing the importance of creating demand for toilets alongside construction efforts. Nigeria currently ranks number 1 globally among countries with the highest number of people defecating in the open space and is widely off track to meet the target set by the Sustainable Development Goals, SDGs, and is crucial to prevent waterborne diseases such as cholera. As of June 24, 2024, the National Center for Disease Control and Prevention, NCDC, reported 1,528 suspected cases of cholera and 53 deaths across 31 states and 107 LGAs in Nigeria since the beginning of the year. The case fatality rate is 3.5%. The NCDC has also placed Nigeria at high risk for increased cholera transmission and impact due to the rainy season. Open defecation, or the act of defecating in open-air locations instead of in covered ones, is a widespread practice in Nigeria, creating a perfect storm for cholera outbreaks. In 2021, the Water, Sanitation, and Hygiene National Outcome Routine Mapping WASH Norm report estimated that 48 million Nigerians, or 23% of the population, still practiced open defecation, while only 8% practiced hand washing. According to a public health expert, Dr. Kazmir Afani, Nigeria has continued to pay lip service to water, sanitation, and hygiene wash. Ifani stated, "I challenge you to go and dig it up." Of the 30 states already reported to have the outbreak, how many of them have a public potable water supply in place? I can categorically tell you none. So, we do know that cholera is a disease that thrives where water, sanitation, and hygiene are at its low rate. Calling for the country to speak to issues, he emphasized the need for improved wash practices, including addressing open defecation and ensuring access to clean water, which are essential for preventing future outbreaks. Most public places lack toilet facilities, and individuals who perpetrate this act of open defecation lack knowledge of the health implications. Also speaking, another public health specialist, Dr. Isaac Igboja, blamed the outbreak of cholera on open defecation in almost all the affected states in Nigeria. There is open defecation in nearly all the states that are affected, and during this time of the year, when rain falls, the feces are carried to streams, ponds, open wells, and other water sources, and these are means of contamination. This isn't just about deadlines. It's about protecting the health and well-being of millions of Nigerians. The fight against cholera and other waterborne diseases hinges on winning the battle against open defecation. It's a fight Nigeria must win for a healthier future, he said.
The Lagos State Ministry of Health has reported 29 deaths and 579 cases since the cholera outbreak began 2 weeks ago. Speaking on Monday during a press briefing, the Lagos State Commissioner for Health, Professor Akin Abayomi, explained that the death rate was due to patients being presented late at a hospital or brought in dead. He adds that no case had been reported in schools. On June 11, 2024, Abayomi warned that the state had recorded an excess report of severe gastroenteritis cases. Abayomi disclosed that cases have been reported in communities around Etiosa, Lagos Island, Ikorodu, and Kosofe local government area of the state. And joining us to discuss more on this is Dr. Adefolari Okpawoye. He is an infectious disease consultant at Lagos University Teaching Hospital and Public Relations Officer, Nigeria Infectious Disease Society. Good evening, glad to have you join me.
Good evening.
Let me just start by...
Glad to be here. Thank you very much.
The pleasure is all mine. I'll start by asking you, are there any factors that make this case more severe in Lagos compared to other states of the country?
Well, apart from the fact that we're a mega city and everything we tend to magnify it, whether it is good or bad in terms of money, the amount of money circulating in Lagos is probably more than other places. So the reality also is that when it comes to things happening like diseases like this, which are worse in densely populated areas, then you can expect that there will be a higher number of cases in Lagos. Also, remember that Lagos has a very robust surveillance system, so it's easier for us to pick up cases than some other people will. So a combination of factors of densely populated areas, the sanitation conditions, and also the enhanced surveillance will mean that we'll record more cases than most people will. Thank you.
It's interesting you touched on Lagos being a mega city and also being highly populated. How effective are treatment protocols in managing these epidemic we have at hand as cholera cases, considering the challenges mentioned by the Commissioner for Health about late presentation?
Yeah, the treatment protocols are effective. However, it's difficult. Our health-seeking behavior generally is not the best. People tend to present to the hospital quite late, for various reasons. I've seen patients who came in late because there was no one to take care of the children at home. A lot of people actually did not realize the seriousness of the condition. Some collapsed right there on the toilet where they were still pooing. So those are the challenges. Cholera is not that difficult to treat in terms of the severity of illnesses. We have illnesses which are much more difficult to treat if people come in early. But when people don't come in early, then it becomes a bit more complicated. Some will eventually end up with renal failure, and even after the initial symptoms have gone. So coming to the hospital early is very important. And we have seen now that treatment is free in the state hospitals. So hopefully this will encourage people to come earlier. And also the importance of starting to take ORS. That's the oral rehydration salt. Immediately you have symptoms. People underestimate the effect of the diarrhea. And that is what is leading to some of the mortalities that we have been seeing so far.
You talked about people not presenting themselves early enough in hospitals. What role then does public awareness or even education play in preventing and also responding to outbreaks of cholera, and other related illnesses?
Yeah, public awareness is hopefully what we are trying to do here, and you also play your part by making a segment on this. Also, it's important to note that a lot of teams have gone out to the various local governments at that level, to the markets, to the churches, also to sensitize them and educate them, number one, on prevention, how to protect themselves better, and also that if in case they have symptoms, how to start treatment even before, and to present earlier at the hospital. So there's a huge role that education and awareness plays in curbing this kind of issues. Number one, to prevent them from happening in the first place, and also to sort of like minimize the impact once it's begun. And hopefully we are all trying to play our part in this public awareness and education.
Now, looking at an urban, state like Lagos State, you mentioned earlier on that Lagos is a mega city, highly populated. What are the challenges in preventing and controlling an epidemic like cholera in Lagos State?
Yeah, so the numbers are a big deal. And when it comes to cholera, cholera is mainly an environmental, a disease of environmental proportions. Is the environment that's actually the problem, then manifests as a health problem, issue. There's something we call WASH, which is what we try to do. That's looking at the water, sanitation, and hygiene. And when you have challenges with the WASH, which is provision of potable drinking water to people, where there are problems with sanitation, a lot of people are still defecating in the open. And that is why some of these things coincide with rainy season. When rain falls, water table goes up. Some of improperly disposed waste will flow into surface water, which people will drink, and then you have this terrible cycle of different waterborne diseases. So dealing with this things can be challenging in a city as densely populated as Lagos. The government is trying. However, we know we don't have very good drainage. We don't have very good water supply to most homes. Most homes don't have pipe or water. And also, we also have to take responsibility for ourselves. And, when you have more numbers, then it's very difficult to police people and get them to do what is right. So those are the challenges with water, challenges with sanitation, challenges with hygiene that a mega city like Lagos will face in handling an outbreak of this size.
Thank you so much for your insight on the news, Dr. Adefolari Okpawoye. Many thanks once again.
Thank you very much.
Thanks for tuning in to Smart Okason TV show. Keep exploring, stay curious, and never stop getting the latest information happening around. Don't forget to like, comment, subscribe, and share to keep the intellect flowing. Until next time, keep sharpening and be smart.